Welcome to another easy nursing review. In this video, we will cover heart failure. Now, let's begin by first learning what heart failure is. In congestive heart failure, the heart is unable to pump sufficient blood to maintain adequate circulation. This results in a backup of blood, and the extra pressure may cause the accumulation of fluid into the lungs. Heart failure is primarily due to problems with the ventricular pumping action of the cardiac muscle, which may be caused by diseases such as myocardial infarctions, endocarditis, hypertension, or valvular insufficiency. Blood will back up into the lungs when the disease mostly affects the left side of the heart. The systemic circulation may be overburdened when the right side of the heart is the primary site of illness. The entire circulatory system may be harmed when heart failure gets severe. Now let's go over the signs and symptoms of the patient, starting with extra heart sounds, such as S3. This is a soft sound caused by vibration of the ventricular wall caused by rapid filling, heard after S2 heart sound, heard over the apex of the left ventricle, fourth intercostal space along the mid-clavicular line. Best heard when the patient lies on the left side, usually indicates heart failure. S4 heart sounds. This is when the vibration of valves and the ventricular walls during the second phase of ventricular filling when the atria contract. Heard before S1 in the same location as S3, usually due to a stiff heart. Murmur. Murmur is a sound of turbulence caused by blood flow. Heard anywhere around the heart. Congestive heart failure, fatigue, syncope, chest pain. Note that there are early, mid, and late signs of heart failure. But because this is an easy nursing review, this video will highlight the main ones. For more information, see our other videos. Now let's go over important labs and diagnostics. B-type natriuretic peptide. This test will show elevated levels in CHF, EKG. An EKG may show signs of ischemia, tachycardia, or extrasystole. CBC. A CBC may show anemia, which is when the hemoglobin is less than 12 in females and less than 14 in males. Chemistry may show renal problems or electrolyte disturbance. Chest X-ray. If the left side of the heart is failing, there will be pulmonary congestion because of the accumulation of fluid in the lungs. The chest X-ray will show an enlarged left ventricle because of the increased stress on the heart to pump blood. If the right side of the heart is failing, there will be pulmonary congestion because of the accumulation of fluid in the lungs. The chest X-ray will show an enlarged heart because of the increased stress on the heart to pump blood. Okay, let's move on and learn about treatments for heart failure. Note that the goal of treatment is to address the underlying condition, such as ischemia, valve abnormalities, or arrhythmias. Peripheral vascular resistance, venous return to the heart, extra oxygen, secreting volume with diuretics, and using drugs to lessen the workload of the heart muscle can all be used. It's important to know the actions of the medications so you can understand what signs and symptoms to look for. Now here are the medication classes, starting with diuretics. Administer diuretics for symptom control, resulting in patient comfort by reducing blood volume. Administer ACE inhibitors to decrease afterload. Administer beta blockers, which help to raise ejection fraction and decrease ventricular size. Administer inotropes to strengthen myocardial contractility. Administer vasodilators to reduce preload and relieve dyspnea. Administer anticoagulants in patients with severe heart failure. Okay, now let's move on to nursing actions. The nursing actions will include the following. Monitor vital signs and look for changes. Record fluid intake and output. The patient should weigh themselves daily to assess for fluid overload. Position the patient in semi-Fowler's position to ease breathing. Administer oxygen as ordered because it helps to decrease the workload of the heart. Nurses will also need to educate the patient in order for them to maintain their health. Tell the patient to eat foods low in sodium to avoid fluid retention. Raise legs when sitting to lessen dependent edema. Call the physician if they are experiencing fluid retention, such as a weight gain of several pounds in 1 to 2 days. Well, that ends this lesson on heart failure. Test your knowledge with a free quiz. The link is in the description below.